Hi, I'm Dr. Rajani and I'm talking about my favorite blackhead routine. Do you have blackheads, enlarged pores? Most commonly people with oily skin get these, but let's look at my routine to reduce pores and eliminate these blackheads. You can reduce the size and the appearance of pores. You're always going to have the same amount. As a bonus tip at the end, I'm going to touch on peels, IPL, and fractionated RF as well. The vast majority of people are struggling with basic fundamental skincare challenges. People either have oily skin or dry skin. Most commonly those with what we call normal skin or non-oily, non-dry are going on a routine. They don't have specific concerns. Now the morning, what are you going to do if you have these blackheads? Number one, start your day off right by cleansing. Use a basic gel cleanser or a salicylic. Now the pH of the skin as you sit there is around 4 to 5, say 4.5. So you want a pH balanced cleanser, either a gel cleanser or a salicylic. I like Anthelios cleanser as a nice basic cleaning cleanser that removes makeup, doesn't irritate the skin. It's sulfate free and its agents remove excess oil without stripping the skin. One thing that people get into a problem is trying to strip the skin of its protective barrier. This has soothing botanicals and it leaves the skin feeling calm as opposed to red and irritated. It detoxifies the skin of environmental pollutants. There's also essential fatty acids in there and they enrich the skin's barrier to prevent the dehydration that so many people have when they have blackheads. They try and dehydrate the skin. So it really gently exfoliates the skin and the dead skin cells. And then of course your actives are going to help exfoliate more. The cleanser removes the excess oil and matter that clogs the pores to begin with. If you find though that you're using a salicylic and it's too dry, skip that step until the nighttime. The other option is to use a moisturizer because even though people have oily skin and blackheads, a non-comedogenic moisturizer will work well. And the benefit of that in the day will be to reduce fine lines and folds. A hyaluronic acid used right after cleansing when the skin is still moist, there may be water on the skin, helps keep that water and trap the water into the skin. Again, another benefit of that program is when you put moisture on, when you put water in the skin, when you put good oils and antioxidant oils, it plumps the skin so you look younger. I don't want to say glass skin here because not everyone wants that, but it does make it look nice. So the hyaluronic acid serum, in the case of mine, has peptides in it as well, and argireline, which helps fine lines and wrinkles. So that would be your great morning routine. Some people do use retinols and AHAs, alpha hydroxys in the morning, beta hydroxys in the morning. There's nothing wrong with that. Keep in mind you want to use sunscreen as your last step. And if you're on retinols and AHAs or BHAs, certainly the sunscreen is important. Your sunscreen is your last step because it's a barrier. It won't allow penetration of your actives. Most people during the day don't do much with their skincare. They have makeup on. Keep in mind you don't want to use anything with oil or oily products or oil-based makeup. The evening, this is when you might double cleanse. What do we mean? You use your gentle cleanser that I talked about for the morning, and then you cleanse after a couple minutes with a medicated cleanser such as a salicylic cleanser. At that point, you can use a retinoic acid, or better yet for many people, growth factor stem cell serum, followed by an accelerator. So either one, and you can alternate nights from there. The growth factors I use are non-comedogenic. Now, what do you do every 3 months? A VFR is what I recommend, Viora fractional radio frequency. There are different ones on the market, and a predecessor to that would be something like the E-Matrix. It's electrical energy, it's fractionated, it means it treats a fraction of the skin, leaves normal non-treated skin in between, so the healing is less. This really helps reduce pores, builds collagen. There's not a lot of downtime with the VFRs. You can watch it on this channel. We can target the surface of the skin or target deeper and everything in between to suit the downtime and what we're seeing in the skin at the time. So keep in mind, I'm not talking about deep heating RF retightening, but fractionated surface radio frequency that actually leaves little dots or little micro holes of energy in the skin. It does disrupt the outside barrier, but that's also what kind of zaps, if you want to think about the pores. Now, people ask me about IPL. IPL is really not going to affect the pores. The heat can kill the bacteria that cause acne, just like the fractionated RF will. So that's good. But the IPL is going to help with reds, browns. If you do a lot of them, you can get some skin tightening. But remember, people with acne, oily prone skin will have blemishes. They'll have red areas left over from the healing acne. And in that sense, the IPL will help. Now, when we go on to chemical peels, again, they can kill the bacteria, which is great, so they can be used in acute acne, and they help with brown spots. They're not going to help that much with reds, but they will help with browns, sunspots, and post-acne hyperpigmentation. They can help sometimes with melasma. You have to be very careful. So that's a great skincare routine. The staples will be, therefore, a good cleanser. Consider a salicylic cleanser, a non-comedogenic moisturizer, retinols. You can watch my complete tutorial on retinols, and AHA, BHA creams, alpha hydroxy acids and beta hydroxy acid combination products. Those are your staples. What concentration you're looking for in a BHA or your salicylic in the cream? About 1 to 2%. And a glycolic will be your staple of your your AHA, your alpha hydroxy acid, as well as lactic acid likely being there. But in terms of your glycolic, 10% is a good number. You do not need to go higher like we go in peels, 30, 50, 70% glycolics. I'm talking about your daily skincare routine, so you can do it at home with low side effects and high efficaciousness. Okay, there you have it. Skincare, pore size. There's a complete video up here on growth factors and stem cells, and I put one down here on pore size. What's your routine? What do you like? Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.